Questions. My state of Oregon ranks second to last in the country for access to retail pharmacies. This is a problem that is not going away. It was reported that in 2024, 36 pharmacies closed their doors. This shortage, like almost every other healthcare shortage, is more acute in rural areas where often only a small number of pharmacies serve an extremely large area. My district, for example, is larger than the state of Washington, and we've been losing pharmacies, and it's leaving communities in desperate straits. Mr. Wright, can you speak to how consolidation in the PBM market and PBM business practices are impacting access to pharmacies in rural areas?
Thank you for the question. I think the issue of consolidation, we've talked about the three major PBMs that control 80% of the market, but I'd also like to stress not just the consolidation both vertically and horizontally. The ability of the integration between insurers, PBMs, and pharmacies means that there is a perverse incentive and a misaligned incentive for PBMs to favor the pharmacy chain that they happen to own, which is maybe unrelated to cost, quality, convenience, customer service, or any of the things that we would want good purchasing to be based on. That it's appropriate to negotiate over those factors. It's not appropriate to negotiate or to be undercut by the fact that you're members of the same ownership group.
As long as I'm asking you questions, who actually benefits from the rebate?
Well, to the extent that the rebate system creates an incentive for higher list prices, then that's a detriment to all of us who pay the price, whether it's patients, payers, employers, union trusts, or anyone. To the extent that the rebate does go to the, at least to the payer, although we don't necessarily know exactly what those rebates are, and that's one of the reasons why the transparency legislation is so important.
And going to that transparency piece, you would think what would happen as a result of total transparency? What's the good that comes from it?
Well, I think that the main point would be that that both patients, but in particular the plans, the purchasers, the payers, would have a better idea of to see if the PBM is negotiating on their behalf for the best cost and quality to be passed through, or to get a bigger rebate on behalf of the PBM. And that's the misaligned incentive that right now we have. It's an opaque situation.
Dr. Chansey, your family has operated an independent pharmacy for 3 generations. Some say that PBMs aren't to blame for the closures of these pharmacies, and some allege that the new generation is simply incapable or not wanting to carry on the business. I find that not convincing. What's your thought?
I totally disagree. The PBMs are directly related to our unfair reimbursement, and some of the tricks in the games that they play are killing independent community pharmacy. As I shared earlier, we lost 450 since June of 23. And when you lose an independent pharmacy in an area, no one's rushing back in to replace them. So you're not just losing a drug distribution point, you're losing a healthcare provider. And in 6 counties in Georgia, that is the only healthcare provider in those counties. So it's a critical situation.
Yeah, but your opinion, what's going to fix it? Because I represent many small communities, and they're losing their pharmacies. What's the best thing we could do here to help?
Well, I think the Chairman Carter's Transparency Act and the No PBM bill that you guys have worked on is a great start. That's going to impact 55% of the business that the average independent does. It's going to do away with the spread pricing. It's going to increase transparency. It's going to have a fair reimbursement model. And we're going to encourage CMS to put in language that's going to be relevant and reasonable contract language between the PBMs and the pharmacies.
What would the next step be?
To pass this legislation.
I'm talking about after we pass it. I'm not optimistic sort. Is there something next that you would like us to do?
Well, I think the next we need to tackle the commercial market.